This is Dementia Empowered, the podcast helping family caregivers navigate dementia care, overcome legal and financial challenges, and make confident decisions to support their loved ones. I'm your host, Patrick Cawley. Let's get started. I thought I had more time, is what the woman said to me about her father. The dementia journey can seem so long, and yet somehow nearing the end is jarring and seems unexpected. Keep listening and you'll hear how your loved one will need an advocate as the end of life nears, why communication becomes even more crucial at the end of life, and how you really need to adjust your expectations. My guest today has personally and professionally guided countless people through the end of the dementia journey. Helen Bauer is an experienced hospice nurse. Her expertise ranges from bedside care to caregiver support to nursing leadership to hospice consulting. She is the voice behind nearly 600 episodes of a great podcast called The Heart of Hospice. Helen Bauer founded Hospice Navigation Services to guide and support individuals and families who are dealing with the complexities of hospice and end-of-life care. Of course, understanding the comfort needs and preserving the dignity of someone with dementia can be a little more difficult. But if anyone shares my vision of empowering caregivers, it is Helen Bauer. And Helen, I am thrilled to have you as a guest on Dementia Empowered.
Thank you, Patrick. It's great to be with you.
Talk to me about the role of advocacy by the caregiver for someone living with dementia.
I think most caregivers who are taking care of their person who has dementia, wouldn't think of themselves as an advocate, but they're the spokespeople, the communicators, the coordinators, the translators, the ones who enact all the interventions. They're the problem solvers. And so in that role, they are advocates. They are speaking up for their person who more than likely either can't vocalize at all or can't vocalize in an organized way what they need and how their lives should run. And they're also advocates for themselves, which is one of the things I always teach is a caregiver should be an advocate for themselves. But most of their energy is going to be taken up in all these little bitty caregiving tasks that when you add them all together are a huge group of advocacy.
That's
In my
really
view.
what it is. I agree with you. And as the end of the journey starts to get nearer and nearer, I think people generally have a sense of a concept called hospice, but we're not trying to fix medical problems anymore. We're looking out for the comfort of the person nearing the end of life. We're looking at preserving their dignity. But as you just alluded to, the brain changes of dementia mean that the person is having difficulty finding the words. They might be completely nonverbal near the end. They may have difficulty interpreting their bodily sensations, much less expressing that they are feeling pain. So, how does advocacy show up for the person who's trying to keep that person comfortable, but maybe can't tell that the person is not comfortable?
I think a lot of it goes into the relationship they've had with the person and how they know them, what that person's disease processes were that aren't dementia related, because dementia itself is not a painful disease, but immobility may be, or arthritic processes. And there are other disease processes that may be comorbidities or diagnoses that are happening at the same time that the dementia is happening. So the caregiver is also the chief information officer because they're the one that knows this person's history, any pain that they've had in the past. And if they really know their person well, behaviors, facial expressions, movements, sounds that they might make, even though they can't enunciate a word and say yes or no or give a pain score, there are things that they can watch for physically. We use a scale called a PAINAD scale, which is basically a series of faces. You look for facial grimaces, a smile, a relaxed face. And then if a pain situation is developing, you would see maybe a serious face or a scowl or tears, even a grimace as the pain gets worse. And so that's how you rank It's the pain scale when you can't assign a number.
And is the
So
person with dementia pointing at one of these faces?
no, no, this is totally judgment on the part of the caregiver.
Oh, I see. Okay,
Yes,
that's
they're
clever.
looking. Yes. Now, if you have someone who is able to identify a pain scale and point to a face, because there are all sorts of, there are very many stages and phases and severity of dementias, right? If you have somebody who can still point to the face and say, "This is how I feel today," that's great. But a lot of times with advanced dementias, the caregiver is the one trying to make that call about whether pain management is needed. So, looking at those faces and knowing those different facial expressions, also you can look at if you're turning your person or helping them to move, do they pull away or do they moan? Do they curl up? Do they guard a body part that's painful? So the caregiver becomes that sort of interpreter for all those physical signals that a patient might give.
So true. That's great. And part of this advocacy is when I think of hospice, I think the time is coming where we're not doing clinical treatment interventions with the goal of prolonging the days of life so much as we are maybe getting rid of some of the interventions and looking for quality of life. But I think that's also for the caregiver as advocate. That means looking out for maybe a calm and familiar setting as opposed to a treatment that would require a clinical setting with lots of beeping and other people running around, and it might be distressing. That seems to come up as a form of advocacy.
It does. Those decisions can be difficult and sometimes emotional. We call it benefit versus burden. What benefit is the patient going to get? Quality of life and comfort versus what's it going to cost them? And not just financially, we're talking about what does it cost them in energy? What does it cost them in time? Because we're talking about limited time. So when you take a person who is dealing with dementia, especially towards the end stages, you take them and you put them in an environment like an emergency room, an ambulance. It's loud, it's cold, it's bright. There are people who don't know how to communicate with them. They can't understand what's happening necessarily. Everything seems painful and startling and stimulating, and that does not help their mental status at all. It's very detrimental. So there are decisions that a caregiver would make to forego that aggressive treatment to choose the alternative, which is stay at home with the comfort, the familiar, the surroundings that keep this person focused and calm and comfortable. Those are hard decisions to make, but a lot of caregivers have to deal with that.
And as hard decisions come up, they're rarely made by a single person, I think. I think there's usually siblings or maybe siblings of the caregiver, or maybe it's the parent still has siblings, other family members, other people on the caregiving team, and they're going to want some input. This is advocacy, this is mediation. And along the way, you've alluded to the caregiver, maybe the primary caregiver, doing all of this information gathering and coordination has to look out for herself or himself. So, talk to me about that kind of advocacy where it's dealing with other people, even in the family.
It's great to have a caregiving village. If you are lucky enough to have other people that are willing to help and available to help and are able to help in a real way, that's fantastic. However, what we know is there are a lot of solo caregivers, either a spouse or a child or a sibling, that are doing the job by themselves, or there is so much discord in the family that would have created a caregiving village that it's not an effective unit to work together. So we call it having seagulls in
Yes.
hospice. Yes.
Yes,
Um,
I know the term.
Yes, yes. When you have a family member who hears about a diagnosis, or maybe you have elected hospice on the part of your person, and then all of a sudden this family member who maybe hasn't seen mom or dad in 5 years swoops in, and as we say in hospice, they poop all over everything.
Yep.
That's where you get the seagull reference. But they're immediately questioning, making caregivers second guess their decisions, making it sound as if you're not doing everything for mom and dad, you just want them to die. And so that discord in the family can be really difficult for a caregiver who's been shouldering most of the decision-making burden for a long time.
And I guess the insinuation at the end of the seagull analogy is the seagull flies away. So comes in, poops all over everything, and then leaves that caregiver with that emotional fallout of self doubt and nothing but criticism, feeling less supported than they already felt. This gets into communication because they're even as a solo caregiver, which can be a recipe for burnout, and maybe the way you communicate with yourself becomes important. But inevitably, even if there are no other family members, there certainly are a range of healthcare providers. There might be other people in the caregiving village. So, talk about how maybe some best practices for communication.
Well, communication is key because you're coordinating care. If you're a solo caregiver, maybe you're coordinating with a facility, with the facility staff, which is super important. You may be communicating with a healthcare team. So, what I always counsel people is it's really important to know when to communicate. Timely communication is major. Report things up front because it's going to get you the help that you need. And also, it'll help to have early interventions for problems that can become really big for a patient. Things like infections and wounds, things like that. Timely communication, be direct. If you have a need, say it. It's okay to do that. I'm a firm believer in direct communication as an advocate because if you don't tell the healthcare team what you need, they will not know. They will not know. Also, I believe it's important to be very respectful. And yet, if there's a complaint, feel comfortable to voice that complaint. It's super important. You're the advocate for this person, you're their spokesperson. It's like having a child, not to infantilize the person with dementia, but it is a lot like caregiving for a child. So, making a complaint and wanting change, wanting better, and asking for the best care that you can get is not an unreasonable thing. If you make a complaint with respect to the right people who need to know, change can happen. And I think that's a very important thing to remember when it comes to communication. I think it's also really important to hear the voices from your caregiving village. But if you are the primary caregiver or you are the medical decision maker legally, a proxy or a medical power of attorney, have confidence in your decisions. I always say, if you are making a decision with what you know right then at that moment in the best interest of your person, you're not going to make a mistake.
What a great North Star.
Yeah.
You're doing the best you can with the information you have. Ignore the voices of self doubt. You're doing the best you can.
Absolutely. And I think so many caregivers get to the end of things towards the end of their person's life and they think we should have done that trial or we should have started hospice 3 months sooner. I wish I had known about this or I wish I had asked about this. But the fact of the matter is you are acting with everything you know in the best interest of your person at the time. That's not a mistake. It truly isn't. Not every journey through dementia diagnoses is easy. There are a lot of decisions to make. I call it atomic decision making. How often are you going to turn a person? Can they eat this food that you're trying to give them? Do you need to change how much fluids they get because they can't tolerate them? There's so many different things. Should we put a catheter in or not? Should I have the social worker and the chaplain come out? And I think that kind of thing is exhausting for a caregiver to have to make those decisions. So, how they communicate with themselves to give themselves some grace, cut yourself some slack. Don't listen to the seagulls. You were there before, and you're going to be there when they go home. So, yeah, give yourself some grace when you communicate with yourself in your own head.
There's a listener out there right now who's saying easy for you to say because when you're in the middle of it, you're seeing red. You're seeing what's right in front of you and it's chaotic. Yours is the voice of perspective, and that is worth listening to because it's true, but it's just so hard to see in the moment. And as people go through this, let's not forget communication with the person who's living with dementia, because, like you said, we're not infantilizing them. We're not parenting the parent. We are supporting them where skills are lost, but we're still treating them like a human being having an experience more and more in the present moment because they have no access to information from the past. And you and I both know Judy Cornish, who wrote a great book called Dementia with Dignity and created the Dementia and Alzheimer's Wellbeing Network. And Judy is, when it comes to communication, especially in late stage Alzheimer's or other dementias where you're nearing the end of life, she says, look, you are their memory keeper at this point. All those times they told you the same story 600 times, now you're telling it back to them because they don't remember it. But that's how you're reminding them that they were loved, that they loved others, that their life had meaning. And so you are a storyteller and you are communicating. Maybe you can add to it about communication with the person living with dementia, but that's really how I talk about this with people.
I think it's probably easier to communicate with the healthcare team or a facility care team than it is to communicate with your person. And
Undoubtedly.
it truly is. And the reason I know this is because my mom has dementia. She's 92, and I am lucky enough to be part of a caregiving village with two older siblings who are amazing and step forward, and we each bring a different set of gifts and skills to the care of my mom. But what I have learned in the last 2 years or so is that how I communicate with my mom can really set the tone for her mood
Absolutely.
and how right, and how her day goes. So, reminding her that she has forgotten something is not useful. And it's really hard to do because if you and I were talking and I would say, "Patrick, we did this and this 5 years ago. We went to dinner, our families met each other." And you would say, "I don't remember doing that." And I would say, "Don't you remember we did this? I can't believe you've forgotten this." So with a person with dementia, there's no reason to remind them that their memory is failing. So my mom has a definite awareness that her memory is not good. Sometimes she's argumentative about it. What her reality is her reality. And you can't argue her out of that or convince her that's not true. So the best way to communicate with a person with dementia, is not to convince them that they're wrong, correct their reality because it's just not helpful, and don't remind them that they can't remember. Remember, I told you this yesterday. Remember, we talked about this a few minutes ago. And I find myself having to really pace my conversation with my mother so I don't do that. But when my siblings and I communicate with her in ways that are different, she's much calmer. She has less anxiety. She doesn't get irritated with us because a lot of times she's irritated, right? It's her reality, and we're trying to push against that for certain things for her health care and things like that. She doesn't want to do that. It's not comfortable. And I think the more we remind her she's forgotten, the more it undermines her confidence.
It will only lead to fear and agitation. And you are testing an ability that the person doesn't have when you say, don't you remember? Or you want to provide more facts or an explanation when they have no logical thinking skills left. It's like asking a blind person to look closer to read the words on the wall. It's just not going to work and it's only going to lead to agitation. But again, a helpful North Star is you can speak the way you normally speak with the care providers, and you gave excellent advice on that, or with your siblings. But when it's with mom, stay in the present moment. If she's talking and she seems agitated, don't, the words might not be as helpful as the feeling behind the words, but you speak to her about what she can take in her senses now, because that's what makes sense to her. And that is, as you said, her reality. But along the way, did you expect any of this along your own personal journey? There are twists and turns. And I don't know, the person I referred to at the outset of this episode just called me yesterday and has been on the dementia journey with her father for quite some time. And as you just so well pointed out, she probably knows so much more about what's going on in her father's heads just by observing little facial expressions and behaviors. So when he started getting aggressive and putting a caregiver up against the wall, she knew that was not her father. Well, It turns out his sodium was low. He had a urinary tract infection. Okay, she could pick up on this. No, we have to go to the hospital because something's wrong. But then it's like, this is jarring that it all seems to be unraveling. It's about preparing for the jarring, unexpected things that happened along the journey.
Well, and it's really hard to anticipate all these different possible scenarios. So, like my mom at 92, she won't die of end stage dementia more than likely. She will have other health problems that result in her death. But a lot of these caregivers who are caring for somebody with dementia have been doing this for 8 or 10 years
Right.
before the person declines into an end of life, late stage disease. It's hard to predict. And dementias can be you've got Lewy body, you've got frontotemporal lobe, you've got mixed dementia, vascular dementia, Parkinson's related dementia. My mom has never been formally diagnosed, but I think she has vascular dementia just based on her behaviors and her thought processes. So, being informed, I think, is super important. Knowing your person and being able to ride the ups and downs a little bit, I think that's super helpful. So, one of the things we have encountered with my mother is she has severe Crohn's disease. And when it flares, she has terrible incontinence, but she's a lousy historian. So when she tells you she's had an episode or there's something going on with her physically, then you have to make a decision. Do we approach her healthcare provider with this information and ask them to medicate her or do whatever she needs based on information that we can't verify? So when a caregiver is advocating, communicating on behalf of a person with dementia, and those physical needs need to be met, but you're not really sure exactly what's going on, it's like the pain signals. Should we medicate or should we not? The daughter whose dad pushed a caregiver up against the wall. What do we do with that? Was he ill or is he really manifesting with belligerent aggressive behavior and maybe needs some medication to take the edge off his anxiety or agitation? So I think being open to the fact that these ups and downs are going to happen is super important. You can't predict all of it, and goodness knows you can't control all of it. But being willing to make room for mistakes that you might make is important and understand the emotional impact. So if the daughter that you spoke with, if her father had been a mild mannered person, a gentle person, and then displays this aggressive physical behavior, a lot of family members would be horrified. People with dementia who lose inhibition. They take their clothes off, they begin to curse, they are overtly sexual with other residents inside a nursing home, things like that that are typically out of character. It's really hard to accept those things emotionally. I know with my mother, you were talking about memory keepers. Your mom is the person who's supposed to know you from the very beginning to who you are right now. And my mother can't do that anymore. She
Right.
can't do that anymore.
And what if she starts, now you referred to brothers, but I've heard it said where mom starts thinking that the good daughter, the one who's always been attentive and supportive, and the other one was more of a wild child, well, mom flips the identities in her mind. The emotional
Right.
response to that, obviously, especially by the good daughter, is going to be pretty rough.
Well, and when they remove the inhibition, then
Yes.
you get this verbal abuse that you don't expect, which is very difficult. And we're talking as if the person you're taking care of, your person, is a so-called loved one. But for so many caregivers, that's not a loved one. It may not even be a liked one.
Right.
You
Yeah.
may
And
be
I
caring for
use
somebody who was abusive.
I'm so glad you brought that up because it's part of the emotional response to the unexpected and everything we've been talking about. And I flip back and forth between various terms, understanding that people in dementia care circles will say your person because they don't want to assume it's your loved one. They don't want to assume it's your family member. It might not be. It's just the terminology. If you say person living with dementia, it's a mouthful. But I realize that sometimes I say loved one, and that might not be the case.
Yeah, that's something new for me in the last 6 months or so. That was brought to my awareness, and I really try not to do that. There's an assumption that this caregiver is so willing and eager, and it means so much to them to pour all this care and love into this person when in a lot of cases that's absolutely not true.
Right? There might be a troubled history, maybe even an abusive history that in any event, the dynamic between parent and child can be complicated. So
Sure.
we can't make any such assumptions, but the expecting the behaviors and what your own voice in your head and your emotions are going to look like is it's hard to predict. And I love that you're saying give yourself grace and allow for mistakes and allow yourself to be jarred because that is a healthy reaction to the circumstances we're describing. And Helen, people really, especially if they're interested in end of life issues and hospice and everything that you're talking about today, you go so deep over, gosh, near 600 episodes, I think, on the Heart of Hospice podcast. Where can people find that, as well as talk a little bit about Hospice Navigation Services?
You can find the podcast on theheartofhospice.com. And the good thing is you can go in and if you've got a term that you're interested in, say dementia or grief or end of life philosophy, things like that, you can search for it and pick up topics. So you can also find the podcast on all the major podcast platforms. You can also find it on the Whole Care Network, which is a huge clearinghouse of podcasts and classes and blogs all about caregiving, any topic related to caregiving. As for the navigation services, I started the navigation services because I got tired of hearing people say, I wish we had known about this sooner. I wish we knew we could have, if they'd had that piece of information about their hospice experience or hospice agency, they would have made a different choice that they thought was better. So navigation services are designed to provide remote support. It's either by phone or by video call, whichever the client prefers. And we talk about everything from end of life care to shopping for a hospice agency. We talk about advanced care planning. We talk about grief and bereavement. We can do a family conference. If they want to book a complimentary 30-minute session, which is what I'm offering right now, the complimentary session for 30 minutes, we can talk about all those things. There's a short questionnaire that they fill out in advance, so I know a little bit about their person and their situation before we get onto the call, so that every minute of that 30-minute session is used to address their questions and concerns and the information they need. I also offer a 60-minute session for $95, and it's up to 2 to 3 people on video chat or phone, whichever they prefer. It allows for people in the same caregiving unit or caregiving village to get the same information at the same time, which is really important to get people, especially if they're remote caregivers, as opposed to being a hands-on caregiver, the seagulls that are from out of town. It gets everybody on the same page with the same information. We can also troubleshoot your current hospice care. If you have questions about the care that you're receiving, you're not sure what's supposed to be happening. Say you're a caregiver for someone with Alzheimer's or dementia, and the hospice agency wants to discharge them off, which happens pretty frequently in the United States. Patients don't decline or we don't document it appropriately. The Center for Medicare and Medicaid Services has a look at it, and they start looking at what we call length of stay. So hospice discharges happen, but not every hospice agency knows how to manage those correctly. And most of the time, the caregivers don't know what they're entitled to and how it should look. So we can troubleshoot things like that. If you're not sure your care is what it should be, we can do that on a navigation session as well.
Wonderful. Helen, this has been so packed with insights and good information, and I hope people follow you to Hospice Navigation Services where appropriate. But thank you for your time today.
Thank you so much, Patrick.
I cover a lot of topics on Dementia Empowered: legal concepts, navigating the healthcare system, financial challenges. These concepts are all connected in dementia care. Coming soon to my website, KeystoneElderLaw.com, is a self-guided course to help you put it all together in one place. Anytime and anywhere, I can guide you through a number of sessions to learn the care skills of dementia. If your family would benefit from coaching, send me an email at info@KeystoneElderLaw.com.